It has been an absolute honor and a privilege to represent my country, to have the confidence of the director and the staff of the Pan American Health Organization, as well as the delegates from the region. We are a very small country, but we're a very proud country. And so to be able to participate at a very high level has been an absolute privilege for me and for my country. Well, we have an awful lot of work to do. And while it is quite heavy material, there's no reason why we can't have a little fun. And so my idea is to try and keep it light, to keep people with a little smile on their face, maybe an occasional laugh, and that makes the day pass just a little bit more quickly. So far, it seems to have been working. And I've been very pleased with the response. People have been engaged, they've been interactive, they've been very pleasant, and so far I think we're having a good time. Well, when you understand the reach, the thrust of the World Health Organization and its regional counterpart, the Pan American Health Organization, this is the place where many of the decisions are made. This is where a huge international budget and the programmatic scope of works is determined. And so at the Directing Council, many very important decisions, commitments, ideas in terms of fighting so many health challenges around the world. This is where it happens. This is the place. And so it's a very important meeting, and much gets done here. So I've been happy to be a part of it. Well, the problem of migration of healthcare workers, certainly in the Caribbean, is an absolutely serious problem. When we look 40 years after Alma Ata, and looking at our strides towards achieving universal healthcare, the migration of health workers, particularly nurses, threatens to make many of those accomplishments unachievable any further. When we look at the number of nurses trained in the Caribbean, roughly 5,000 or so, that start training, about 55% of them never finish. And then of those that do finish, we find that less than 20% remain in the region. This is a serious problem that has an impact on staffing health facilities, providing primary care services in the community, and especially for smaller island states. It is a massive problem. It is no longer a problem that can be dealt with regionally. It has to be dealt with at an international forum. And I think that PAHO and COSOD have sought to bring this to the attention of the world. When we all seek to achieve universal health care for everyone, all of these issues that might not seem to be terribly important take on a huge significance. And so I'm very grateful that the COSOD sought to put it very high on the agenda. And we are now going to push this issue at further and further levels. It is, for me, perhaps one of the greatest challenges to the delivery of health services in the region.